Thank you, Mr Speaker. This afternoon I rise to speak on this matter of public importance around health, and in rising this afternoon to bring a highlight to the many concerns in our community around the health systems and the delivery of health services to Tasmanians, I want to take a moment to highlight how intertwined all the challenges being faced by Tasmanians are at the moment that add to the burden of the health system. We know that, as been outlined by our Deputy Leader and Shadow for Health, we know the statistics around health, and someone once told me that when you go into statistics, people switch off. When we're talking about numbers, it can distract from the fact that we're actually talking about the experiences and the well-being and the pain often and the trauma of people. But this morning, in response to questions, people would stand on their feet and rattle off a whole lot of statistics as though that's an answer to the question, without actually really having a heart for or sharing the real understanding of the impact that the challenges in our health system are having on people, on Tasmanians. We know how many people are waiting for critical services. We know how often ambulances are ramped, how impactful the bed block is. We know how the issues with access to oral health, to dental health, and the impact that can have on people as young people when they're growing up, and the other health issues that might present in the community. We know all these issues, but what we also know is that despite some activity and some announcements by the government about their response to this, that not enough is being done to ensure that the Tasmanian community feel like they can be confident that when they need support, whether it be with their physical well-being through the actual primary health system or whether it be with their mental health. We know that the more someone is in pain, the more someone is traumatised, the more someone needs support and they can't get it, or they can't get support for their family members, for their children, it puts a burden on an already complex and often critical experience of living. We know that the pressures of the cost of living across Tasmania at the moment are requiring people to make choices that have an impact on their health, which is then further burdening the health system. We know, and I know in Bass, members of our community are talking to me about the choices they're making about whether they're having heating on in their homes. And by not heating their homes, they're putting their health at risk by living in substandard accommodation that is presenting all sorts of health challenges, where we've had episodes of black mould being presented to us, and we know that people having to continue to live in those circumstances is contributing to their poor health, which is putting greater pressure on the health system. There are so many challenges for this government right now that are being left unaddressed and that are not being attended to in a way that's really making a difference, that it's growing this massive pile of burden on an already overstretched health system. Just this morning we were attempting to interrogate the priorities of this government and the way they're out of touch with the needs or the expectations of our community in terms of their expenditure and effort into infrastructure. That where we have, for instance, the two stadiums, one in the north and one in the south, and this contemplation of an immediate investment in a third stadium, where we know that reports have said maybe in the next 10 years, maybe down the track, we might need to invest in that. But right now, when Tasmanians are hurting, when they can't get the access to the healthcare they need, when they need it, where they need it, when they're struggling with the expanding costs of living, when they're not able to pay their bills or buy the medication, we are aware of people that are making choices daily about the medication that they actually purchase because they can't afford it all, about the services they engage with because they can't afford it all. And when you're a parent and you've got a child and you can't provide either the medication or the access to the service for your child, there's nothing more heartbreaking to hear from another member this morning recount the story of a parent that had to go through the experience with their child and not being able to get an ambulance when they're needed, when other people that wait for delayed ambulance services and have passed away before care can be provided. They're the traumas that are actually piling up upon people in our community, where they're just nervous and can't trust the health system in Tasmania. We know that more needs to be done, that rattling off statistics and rattling off announcements doesn't actually equal action, and it doesn't actually build a feeling of confidence in the Tasmanian people that this government is understanding the issues and in touch with what they actually need. We know that across Tasmania right now, there was a mention this morning, and I talk about the way these issues interweave. There was a mention this morning about a response to the housing issue. When you are homeless and you're sleeping rough and you have got layer upon layer of either physical health or mental health issues and you don't have stable accommodation, again, the ways people are presenting and the issues that they were presenting with that should have been dealt with and supported so long ago are adding to the burdens of the health system. When you're a young person, you can't access education, which impacts your literacy levels, which impacts your health literacy levels. As you grow up, your ability to engage in and advocate for yourself in a failing health system is also a challenge. People in our community feel deflated that they're not able to advocate to the point where they can access the health system that they need. I had a message just recently, only just in the last day, from someone in our community who's been waiting for years to get support with mental health via GP referrals, not always having the funds to go to the GP, but when going to the GP, not being able to get the support for the mental health support that they need. And in a message to me just yesterday, you know, they're saying that they're struggling, that this is really hard. They're a small business operator. When you're personally struggling, that makes your business struggle, then you can't provide for your employees and your team. These layers upon layers of concern that are facing Tasmanians every day, whether it be with housing, whether it be with health, whether it be education, it is building up people in our community who have much greater issues that are putting a much greater burden on our health system. And what we need is a government that actually admits the challenges they've got before them and addresses those challenges immediately for the people of Tasmania.